Okay, so I got a really good question on one of my videos last week from Bella, and it was a video about why deep tissue massage doesn't work. And she wrote to me. It was a longer question. Let me read it. She said, "Hey, I'm really enjoying your videos. I do have one question, however. So I got whiplash last year, and I suffered some pretty severe brain fog for a while. Since then I have been doing self massage and going to a manual therapist and getting chiropractic adjustments. I've gotten a lot better. When I do self massage on my neck, I can literally feel the brain fog clearing up. What is the correlation behind that? Someone would tell me it's a gut problem, depression, anxiety, lack of sleep, all that stuff. But obviously, the problem is coming from the neck. I'm just curious to what is actually going on." And then she continued, "Actually, I take that back. There's a lot of layers to the onion that had to be peeled, but is there any correlation between muscular dysfunction in the neck, in the neck and brain fog you've noticed in your patients?" Thank you. Thanks for that question, Bella. Thanks for watching. Um, Couple things. So one thing when I'm looking at an injury, there's always like four components to the injury. One of those is just like a structural problem. So structural problems tend to be like in the bone, in the cartilage, in the disc, in the tendon. Then you also have like a tissue problem. A lot of times that's in the muscle, the ligament, around the nerve. There's also a metabolic issue. There could just be problems with the gut, inflammation, systemic inflammation. The last one is just like a psychosocial component, like how's that pain affecting their mind, how they feel, what they think, and how they're experiencing it. What happens is everyone always wants to try to like make it one size fits all. Like certain people are like, "Oh, it's just your gut." Other people like pains all in your head. Surgeons are like, it's just structural. Soft tissue practitioners are like, yeah, it's just soft tissue and it's what it is. It's a combination of all. But whenever I have trauma, like you had with the whiplash and things like that, I'm thinking more that this is definitely a structural and a soft tissue type of injury. Yeah, there's metabolic issues as well associated with that, where you can get some inflammation and stuff like that too. So you always got to make sure you're eating right, breathing, drinking water, being a normal human, but that's not going to fix everything. So what you're seeing is when you have a whiplash injury, a couple of things that happen is there's some damage to the ligaments, and there's a ligament that runs right up the base of the skull, particularly called the nuchal ligament, and it goes from the top of like the occiput down to about C7, and it's crazy. All the muscles in the neck actually anchor to that ligament. It's really thick. Look at it under like anatomy or like in a book, and you'll see how big it really is. And what happens is when you get that high force in there, what it does is it causes some of that ligament to tear. And when the ligament tears, it doesn't heal right. So the body actually goes in and lays down some scar tissue in there. When that scar tissue gets in there, it makes the ligament weaker and less flexible. Now the spine can't move how it's supposed to. And then what happens is it causes the surrounding muscles to have to work harder, puts more pressure on the joint, on the disc, everything like that. What you're also experiencing, and I think is happening, is right at the base of the skull. Out there, you have some of the nerves. They're called the occipital nerves. You have the greater occipital nerve, the third occipital nerve, and there's a couple other nerves, even the accessory nerve that comes out through there. And what happens is when that scar tissue starts to form, it gets bigger and bigger. It's like a space occupying lesion. And eventually, what it can do is it can compress down on the nerves. It can even get some of the blood vessels as well. And that scar tissue gets bigger and bigger. So when you're doing that self massage, what it's doing is it's stimulating in your muscles and your joints and basically in your spinal cord. You got two things that move. I'll get a little nerdy here. You have one pathway that's for pain, and you have another pathway that's for vibration and movement. They actually compete in the same spot in the spinal cord. And basically what happens is when you start to stimulate those mechanoreceptors, they block some of that nociceptor, which is pain, and things start to loosen up a little bit. And when you're doing that self massage, what happens is, well, you start to get some blood flow and you get some oxygen. It takes that pressure there and relieves it a bit. And that's why you're finding some of that relief or that brain fog goes away, because you're actually getting some blood flow. When you have a lot of scar tissue in there, it doesn't just cause decreased flexibility and pain and weakness. There's not as much blood flow that gets in there as well. So when you're able to get in there and stimulate some stuff, it does help free it up a little bit. Now, self massage is a little tougher because it can cause a little bit more issues in there. It's getting some of it, but it's not getting all of it. It's like, think of this injury as like a cavity and it needs like a drill, or someone to go in there very focused, like a soft tissue specialist. when you're doing self-massage, kind of like brushing and flossing, it's helping, but it's not really getting to the root cause of what's going on. But the reason your brain fog lifts is because just getting that pressure off of there. It's the same thing like when you jam your thumb in a car door, the first thing it's going to do is start to shake it out just like that. And when this happens, it just blocks some of that pain. So that's why it's happening. But I've seen this a lot with clients, especially when I work a lot of the basically like the C7 up to the base of the occiput. There's a lot of nerves in there. There's a lot of blood vessels. And when you get some of that scar tissue out of there, it takes that pressure up and it takes the pressure off and it frees up a lot of stuff in there. And you can feel some weird symptoms at first as you open it up, but it gives you relief right away as well. So thank you so much for that question. And if anyone else has any questions, send them my way. I always like to help. And thanks for watching the video, and we'll see you on the next one. Bye.